Welcome to Therapy Facts with Dr. Jenn. Today we are talking about the interview between Shannon Sharp and Amanda Seales at Club Shay Shay. Point number 4 answers the question, why get diagnosed with ASD as an adult? So we've been talking for the series about Amanda Seales' assertion that she has been diagnosed with autism spectrum disorder. Then, during the course of my series, she admitted that she had not been formally diagnosed. So, we talked about the meaning of the diagnosis. We talked about how to get diagnosed. And in the discussion about how to get diagnosed, we talked mostly about the importance of diagnosis, especially early assessment and diagnosis for children. And I talked a little bit about what the benefit of diagnosis would be for adults in the point number 3 video. So I wanted to come back to the topic. First, to say that the fact that Amanda sought to even understand the challenges that she has faced all of her life as an adult is rather commendable and unique, because very often people believe that when they arrive at adulthood in whatever shape they're in, they believe that whatever may have ailed them in their childhood is a thing of the past. And even though they may continue to have symptoms and some challenges, they tend to ignore them to the extent that they are able to live their lives without a lot of negative consequences. However, when the negative consequences start to pile up, if they decide to take a look at themselves, they may seek assessment and diagnosis. And so the first reason that an adult would want to be assessed and diagnosed relative to autism spectrum disorder or any other brain disorder that's usually first detected in childhood and does not go away in adulthood, such as attention deficit hyperactivity disorder. The reason someone would want to get assessed and diagnosed is to better understand the challenges specific to autism spectrum disorder is the challenges that are brought about by communication and social interaction challenges, as well as the different symptoms that can come along with those two key features, as we talked about in the previous videos. And so, for example, Amanda gave us plenty of examples of challenges that she has had in her adult life, mostly work-wise, relative to her challenges with social interaction and communication. Other challenges can arise with respect to personal life, respect to relationships, with respect to parenting. There is nothing that will test the mettle of what you are made of than parenting. So a lot of people figure out that they have ongoing challenges when they become parents, because the work of parenting is so arduous and much of it requires us to take a look at ourselves. So when a person finds themselves in the position of having ongoing challenges at work, at home, or in relationships, going from job to job, going from place to place, going from relationship to relationship, and they find out that the common denominator, or they realize that the common denominator is themselves, then that might actually drive them to seek assessment and diagnosis for whatever may be ailing them. The next reason, the number 2 reason for adults to seek assessment and diagnosis, again, for autism spectrum disorder or any other lifelong brain-based developmental disorder, would be to get treatment. There are treatments, as I said, behavioral treatment primarily. However, there are other symptoms. There are symptoms that go along with ASD that can be treated through medication. Pure ASD, if we want to call it that, if there is such a thing, is treated by behavioral intervention, by skill building, helping people to better understand their symptoms, their challenges, helping people to then learn to behave in ways that mitigate their challenges, and help them to communicate to other people what their challenges and what their needs are. And so in no way is assessment and diagnosis for the purpose of having an excuse to behave badly, right? So given a diagnosis, if that comes along with the assessment, then the next step would surely be treatment in order to improve the quality of life of the person who was diagnosed, but certainly to improve the quality of life of the people who are impacted by them. How many people talk about bosses at work who are on or off their medication, and how many people are impacted by that status? And a lot of times it is tongue in cheek, but it does speak to the myriad of circumstances or the myriad of people who are in the circumstance of having supervisors who impact our daily lives, our daily work lives, where we spend the majority of our waking hours. How many people are impacted by people who are undiagnosed and or untreated, again, for a myriad of brain-based disorders that do not go away in adulthood. And so then you have relationships where we have partners, people who have partners who are undiagnosed and or untreated, or diagnosed and still untreated, and how those experiences impact the quality of life of the spouses. And then again, what a shame. It's a shame for bosses. It's a shame for partners and spouses. It's also quite a shame for children to have undiagnosed and or untreated parents who are responsible for guiding them through the world, and I dare say guiding them through their own challenges that may have come to them in the gene pool. To have parents who are undiagnosed and just wreaking havoc on the children and their partners and probably their own parents and siblings because of their untreated behavior. And very often they are either wholly unaware, or they have some awareness rather, and a lot of fear, which leads to a bunch of denial. And so that's the reason to seek assessment, diagnosis, and treatment as an adult. Those are the reasons, so that not only can the person have their lifestyle improved or their quality of life improved, but for all the people that they impact, have their quality of lives or living improved as well. Now, the one thing that people don't talk about in the popular culture so much is another reason to get assessed and diagnosed and treated in adulthood is for the purpose of receiving Americans with Disabilities Act, or ADA, accommodations at school and at work. Very often, adults who had diagnoses and IEPs, individual educational plans, or behavior plans in school, they graduate from high school and they think, oh, great, I'm away, I'm getting away, I'm free from the stigma and the labeling of these plans. However, guess what? Again, if you had those plans, whatever you were diagnosed with probably did not go away in adulthood. And so maybe you find yourself going to college or some education or training program, and you just cannot do it for the same reasons that K through 12 was challenging for you in the first place. But the difference this time is that you don't have any accommodations. You don't have any extra help. You don't have any extra time to turn in assignments. You don't have any extra time to take tests because you decided you were free from the stigma and the labeling. Well, guess what? As an adult, people who have qualifying diagnoses, I'm going to say it like that. I'm not going to say disabilities, but that's what I mean. People who have been assessed and diagnosed or reassessed and re-diagnosed, right, in adulthood, you have the opportunity to receive ADA accommodations in school, but not just in school, but on your good job. So if you again require these certain special circumstances in order to be successful at work, again, additional time, additional training, training in a particular format, assistance with communication, etc. The ADA is a federal law, and it provides for people with diagnoses who need additional help to be successful in the workplace. So getting an assessment and a diagnosis as an adult allows you to ask for your ADA accommodations at school and at work. And that can be a game changer. If you're somebody who can't, let's just be honest, can't hold a job much past the introduction probationary period, because when it comes time to produce and perform at the expected full level, you just can't do it. And you keep going from job to job. You look great on paper. You interview like a champ. But when they say when the proverbial rubber hits the road, you fall down on your face. That is because of your brain. And again, it may not be ASD. It may not be ADHD. It can be any number, again, of conditions that impact you, but you need assessment, you need diagnosis, and then you also need treatment. Because again, the assessment and the diagnosis is not for the purpose of having an excuse. It is for the purpose of having an intervention and then having accommodations to support and enhance the intervention in order to, again, support the best quality of life that the individual person can have, along with their coworkers, family, friends, and children. So that's point number 3. Now, point number 4, speaking of children, it is a great idea for adults to get assessed, diagnosed, and treated. I talked about as part of being a parent, right? But also so that you may understand what symptoms and challenges you may have already passed along to your children, or you might pass along to your children. And if you're someone whose children don't seem to be impacted by everything or anything that you might be suffering from, know that your grandchildren can be impacted as well. Your challenges came from somewhere, came from the same place that your eye color and your hair color came from, okay? So just as those elements were passed down to you genetically, whatever is challenging you can be passed down genetically too. And it does not have to just go to your children, but it could go to your grandchildren and their children as well. So when families understand what is in their gene pool quite directly, then they can make decisions about how to, again, treat the children who have already arrived, and then what to do about the children who have not yet come. So being able to own your symptomatology and to understand what it is, where it came from, and how to manage it, and how to get help managing it as necessary are all reasons to get assessed, diagnosed, treated, and accommodated in your adulthood. So many times people are fearful of what the results might be. But I always suggest and encourage people to just start with the conversation. The conversation is not a decision, it is not a treatment plan, and it is not a lifetime of possibilities. It is just a, a conversation. So start with the conversation regarding assessment, diagnosis and treatment, and accommodation if necessary. As the old commercial used to say, the commercial for diabetes medication, if you won't do it for yourself, do it for the ones you love.